Hey everybody, we are going to be talking about waved testing, which is chapter 15 in your textbook. If you recall, in 1988, the Clinical Laboratory Improvement Amendment, so CLIA 88, identified 3 levels of complexity for medical laboratory testing. This was the high complexity, moderate level complexity, and the waved testing. So we're going to talk a little bit briefly again, just as a refresher about those 3 levels in a second here. But just so you know, with waved testing, sometimes as a phlebotomist, we're trained to do these waved tests. So, and I should have gone to my objective slide. So we're going to talk, like I said, about those 3 levels of laboratory testing. We're going to talk about the erythrocyte sedimentation rates and factors that affect that, various types of urine tests that we might do that are waved, and point of care testing. So there we go. Sorry, I meant to go forward in my slides. As phlebotomists, we might be trained to do waved testing. Test kits for tests that have been determined to be waved are easy to follow. They have instructions that come in the box. Most of them come with built-in controls. You can control your tests before using them on patients. Some of the most common wave tests you'll see, and this list is ever growing and adding to, but we've got that erythrocyte sedimentation rate, or the ESR, fecal occult blood, microhematocrit, strep screening, urine pregnancy testing, urine chemical testing, and then the point of care testing. So all laboratories have to comply with the CLIA 88 mandates. They say that there must be a designated individual in the lab that helps to ensure that all guidelines are being followed. And this includes following all applicable federal, state, and local regulations for laboratories and testing, that you perform wave tests only tests that have been waived, follow all manufacturer's instructions, allow for random inspections, establish a safety plan that follows OSHA guidelines, ensure adequate staffing, and that we are appropriately trained, especially if there's a new test that comes through, and that documentation is done for each test as well. So the different testing levels, let's talk a little bit more about that. The high complexity tests, these require close attention to detail. So they have a lot of different steps. They present challenges during the pre-examination, examination, and post-examination phases. These medical laboratory personnel are expected with these high complexity tests to be able to manually manipulate some high complexity equipment and reagents, and requires troubleshooting and interpretation as well. Examples of high complexity testing might be manual DNA extraction or intricate special staining procedures. Next, we've got the moderate complexity testing. These kind of fall, of course, as you would imagine, between the low complexity wave tests and the high complexity. So they do have a few procedural steps that are not highly complex necessarily, but they do require some formal training. Some of these things might include running automated instruments. There might be some manual manipulation of special reagents and some interpretation and troubleshooting as well. Examples of this are provider-performed microscopy procedures. So we're going to talk about our waved tests now, and this is what this presentation, of course, is focusing on. These are procedures that the FDA has cleared for use, whether it be in the home or in the laboratory. They're simple to use, they're easy to interpret, and they produce accurate results. These tests don't require much training. Various tests have been continued, as we mentioned a second ago, and we continue to develop more that are waived. Each test, like I said, is going to come with specific instructions for those tests from the manufacturer. All right, so let's jump into a few of these waived tests. So erythrocyte sedimentation rate, or ESR, that is the rate at which red blood cells settle in whole blood. This screens for the presence of inflammatory processes. So it doesn't diagnose any one specific disease or problem alone, but it does signal that there is some inflammatory process going on in the body. And the way this works is that when our body has an inflammation process going on, the number of plasma proteins increases in our blood. When the number of plasma proteins increase in our blood, the red blood cells get smushed together in clump and makes them heavier, and that's going to make them settle faster. So the faster they settle, we know that there's some inflammation processes going on. There are several methods that exist for testing ESR. It's important to remember that specimens should be less than 4 hours old, but they can be performed on refrigerated blood up to 12 hours old. And of course, you're going to want to refer to your facility specific procedures and policies related to that. Some factors that do affect the erythrocyte sedimentation rate, temperature, like we just mentioned, the testing time as well, tilting and vibrations. All of those things can actually cause the red blood cells to settle at a different rate than they would if we just let this process happen appropriately. Fecal occult blood testing is another way to test that you might be involved in as a phlebotomist. Blood that is found in the feces or stool that might not be visible to the naked eye is found by doing some different occult blood testing. If there's blood in the stool, this could be a sign of infection, an inflammatory condition, trauma, ulcers, cancer, hemorrhoids. This is done using, you see that little cardboard square right there, and we've got the solution as well. So this paper that is on this cardboard is impregnated with guaiac, which is a chemical that turns blue when it comes in contact with blood. So to run this test, you're going to apply a thin layer of stool to the front of that guaiac card right there. And then on the opposite side, that solution is hydrogen peroxide developer. You're going to add a few drops to the back of the card. If blood is present in the stool, the guaiac paper is going to turn blue. And that's how we know that there's blood present. Because of the possibility of false positives and false negatives with this test, the physician is going to often order fecal occult blood times 3. And that requires 3 different samples from 3 different specimens. Let's see, let me see the microhematocrit is on there. Okay, there's not a slide for it, but we're also going to talk about microhematocrit testing. This is used to test for anemia. It's a measure of the packed cell volume of red blood cells, or basically the percentage of red blood cells in the whole blood. Microhematocrit is a procedure for determining the hematocrit and requires only a small amount of blood. And microhematocrit testing can be performed directly from a dermal puncture. It can also be collected from the microcollection tubes. A microhematocrit centrifuge can also be used, so it's specifically for these micro samples. And then there's a special device that we use. Once those tubes have been spun in the centrifuge, we're going to line them up on this device. This is on page 415 in your textbook, where you can see a good image of this to get our appropriate reading. There's also strep screenings. This is another common way to test that you might see in a clinic or in a laboratory. Of course, this is used to detect if the bacteria that causes strep throat is present in the back of the throat. Test kits may have several reagents that need to be applied in a particular order. So again, you're following manufacturer instructions. And the controls are built right into the testing device so that you know that the test has been performed correctly, and you're comparing the result from the patient against the control. All right, so let's talk about some urine screenings, because we can do several different screenings with urine. Let's see, we got urine pregnancy test. This is performed to confirm or rule out pregnancy. When a woman is pregnant, the placenta pretty early on in the pregnancy will start to produce the HCG hormone. It's actually detectable as early as 10 days from date of conception. Pregnancy tests, of course, you can do at home or in the laboratory setting. Just like the strep test, they also have that built-in control so that you know the test was performed properly. When we're talking about a urinalysis or a urine chemical screening, this is done, or I guess a urinalysis or a urine chemical screening is part of a full urinalysis. The urine chemical screening looks at the particular chemical components in the urine. And we are actually looking at several things when we're looking at a urine screening or a urinalysis. We're looking at the color and clarity. That's one assessment tool we're looking at. We're looking at the chemical makeup, which is what we have the dipsticks for. Let me see if there's a picture of that. These dipsticks, when we dip them into urine and compare them to the control, we're going to be able to know things such as the pH of the urine, specific gravity or the concentration, if there's any blood, bilirubin, or glucose present in the urine, ketones, white blood cells, proteins, nitrites, etc. So this is going to give us a good general picture of the status of the bladder, the urinary system, but also can detect things like possibly being a tool to help diagnose diabetes or a urinary tract infection. So you want to make sure when you're doing a urine analysis that you're reading those reagent strips, or those test strips in the appropriate time, and make sure you go by the manufacturer's recommendations for how long they need those strips to sit before you actually read them against the control. Competency number 15-2 on page 418 in your textbook is going to give you a nice step-by-step procedure for a urine chemical screening. Let's finally talk about point of care testing. If you recall from earlier chapters, this is testing that happens right near the patient, whether it be at the bedside or they come to a specific little testing station and it's done right there with all the equipment in that place. It's designed to reduce cost while enhancing patient care because they get the results right away. It involves collecting a specimen and then immediately testing it on an instrument that is typically right there again at the patient's bedside. Some examples of common point of care testing that you will see and or possibly use: glucose, hemoglobin, cholesterol, blood gases, and coagulation studies. Typically, these types of tests, just like in that image there with the blood glucose monitoring, just require a very small amount of blood from a dermal puncture. But we do have to rely on these instruments to be accurate, right? So they have to be calibrated on a regular basis. And we talked about calibration in our previous lectures. Glucose testing in particular, because that's one that happens pretty regularly, is used to screen for abnormal glucose levels and to help monitor glucose levels in patients with diabetes. This can be performed at the patient's home. A lot of time they're doing this on a daily basis to monitor their own levels, or of course in a lab setting. Before we do any kind of glucose testing, we want to make sure to always run the controls to make sure that our machines are within their normal ranges and working properly before we start testing our patients. On page 421, it's check your competency number 15-3 is going to give you the step-by-step guide for the glucose point of care testing. So make sure to review that along with the other point of care testing steps in chapter 15, just to get familiar with some of those, as those again might be something that you're starting to do as a phlebotomist, whether that be running the controls for a new test kit, making sure that the quality checks are done, the machines are calibrated appropriately, and that you're performing these procedures accurately to get the best results. And that's it, you guys. Thank you very much.